Okay, now I'm going to be examining your breast, and if we were in the office, I would have you take your shirt off. But go ahead and lift your arms up. Okay, so while your arms are lifted, I would check both of your breasts for any dimples, make sure they're symmetrical. And when you lifted it, they're supposed to move, which is good. And I want you to also, you can put your hands down, I'm sorry. Um, and go ahead and put your hands on your hips. Okay, good. And both ways up and on your hips is when you're going to be checking for any dimples. Make sure they move and no symmetry, nothing abnormal that you might notice. And you should be checking, doing breast examinations on yourself. You can do it in the shower, and if you put your, one of your arms up, yeah, and just feel around your breast like this, you would feel for nodes, any abnormalities, any bumps. And also, I'm going to be checking here your axillary nodes. And this is the palpating. I'm making sure I don't feel any nodes. And this side. Okay, good. And now I want you to go ahead and lay down. Maybe the other way. If you can lay down the other way. Okay, much better. So when you're at home, you can be laying down straight and make sure you're at a 30-degree angle. And lift this arm up here. And put this right here under. Go ahead and move up a little bit. Okay. Go ahead and move it up. This arm like it was. Okay. And the same thing. I would be going in circular motions and feeling around the breast. Make sure I don't feel any lumps or bumps, anything abnormal. And then in the middle, your nipples, you want to squeeze them. Make sure there's no discharge or nothing unusual. Okay, good. So I didn't notice any, which was good. Let me go ahead and move. Okay. All right. Okay, so that was, you can go ahead and get up now. Okay. So can you go ahead and demonstrate for me when you're home how you would be checking your breasts? Okay, good. And circular motion all around. Okay, good. And you would do that with both breasts, okay? And you would feel for any lumps, anything abnormal. Okay, now the next test I'm going to be doing is I'll be examining the vessels of your neck. So why don't you go ahead and lay down again? And I would, if I was at the office, I would have a bigger light, but go ahead. I'm just looking at your neck vessels. Okay, good. And the pulsations, which is good. Okay, now the next thing I'm going to be, I looked at with the light your jugular venous pulses, which was good. And also, if indicated to check if I noticed any abnormalities, I would also check the jugular venous pressure. And for that, you would just need 2 rulers and place one right here and at the base of where the trachea is, and measure that pressure right there. Sorry. Okay, so the next thing I'm going to be doing is checking the heart. I'm going to be checking your pericardium. If we were in the office, your shirt would be off. Your pericardium, which is right here, I'll be checking for the pulsations, and such as any heaves or anything like this. And let's see, so I'm just feeling, make sure I don't feel any heaves or anything. Okay, now I'm going to be palpating the apical impulse, which is right here. It's right here, like the apical pulse. And we already did the precordium test. I didn't feel any thrills. And the apical rate and rhythm was within normal range. And now I'm going to be listening to the heart sounds. And I'm going to start right here. Okay, good. So the heart sounds were really good. And now for any extra sounds, I'm going to check with the bell of my stethoscope in the same systemic pattern. Okay, good. I didn't hear anything, which is good. And now if you can go ahead and lay to your left, turn around to your left. Okay, good. All right, now I'm going to be listening again for the apical pulse with the bell, and I'm going to make sure I don't hear any extra sounds. Okay, good. So I didn't, which is good. Now go ahead and lay down straight. I'm going to be checking your abdomen. If you can lift your shirt. Okay. All right. Okay. So now I'm going to be, I'm looking at the contour of your abdomen, the symmetry. I don't see any lumps, any bumps, any rashes, anything abnormal. There is a little hyperpigmented skin here. Is that a burn mark or your birthmark? Birthmark? Okay, so she does have a birthmark close to the umbilical, and the umbilical is in the midline, which is good. It's exactly where it's supposed to be. And the skin characteristics looks really good. And now I'm going to be listening to the bowel sounds in each quadrant. Okay, good. So all the bowel sounds were within normal range. And now I'm going to be checking the vascular sounds. I'm going to be checking the vascular sounds of the aorta. Okay, the renal arteries. Okay, the iliac arteries. And the femoral arteries. Okay, good. So the vascular sounds were normal. Now I'm going to be percussing the abdomen, and I'm going to be checking to make sure the organs are exactly where they're supposed to be. And I can feel the difference between Tiffany and dullness. The splenic side is a little dull. The sound of it is dull.
That's how it's supposed to be.
Yeah, so that's good. That's where you know where your spleen is. Okay, good. So the percussion was really good. And the liver spin in the right and clavicular line was within normal range. And the spleen, I was able to feel that. Now I'm going to be doing light palpitations within the abdomen feeling for any lumps or any bumps. And let me know if you have any pain. Okay, now I'm going to be doing deeper palpitations. And before assessing the abdomen, you also want to make sure that the patient had voided and and their bladder is empty. So when you're assessing it, you don't want to put any pressure on the on the bladder. Okay, the next thing we're going to be doing is the abdominal reflexes. Okay, good. So that was normal. Okay, now the next thing, if you can go ahead and, actually I'm gonna, checking the pulses, the inguinal area, your femoral and inguinal pulses right here, since you're already laying down. I will check them, which is good. And also the inguinal lymph nodes, which are right here. I didn't feel anything, which is good. Okay, go ahead and sit up. All right. Or you can actually stand up. I'm going to examine your lower extremities. If you can put your, okay. Good. I'm checking to make sure that they're symmetrical, which they are. Good. No lesions. I haven't noticed anything bruising or anything like that, which is good. Turn around for me. And check the back of the legs for any varicose veins, which I didn't notice any, so that's good. Okay, now the skin characteristics and everything looks good. So go ahead and have a seat. And the skin characteristics, the hair distribution is within normal range. And now I'm going to be checking your pulses. First, you can just relax. I'm going to check the pulse in the back of the knee, right here, which is the popliteal pulse. Relax. Okay. I'm just feeling your pulses. Okay, good. The posterior tibial, let me see the other leg, which is right here. You can just relax. Okay. Feeling your pulses. And your dorsal pedis pulse, which is in the front. Okay, good. And let me see. It would have been better if I had you lay down, but now I'm going to be checking the temperature of the skin, which is good, and check for any preorbital edema, which I didn't notice any, which is good. Okay, so now the next thing I'm going to be doing is checking the range of motion of the legs. And when you were laying down and you moved up, I was noticing the range of motion and the muscle strength of when from laying position to sitting, which is good. Let's see. So if you can go ahead and lay down again for me, please. And I'm going to be checking the range of motion again. Can you lift just one leg up? Down. Okay, the other one. Down. All right, now go ahead and bend your knees and touch your chest. Good. The other one. All right, and go ahead and your ankles, move them out and in. Okay, good. And squeeze your toes. Okay, good. And also you want to look in between the toes to make sure there's no lesions, which I don't see any, which is really good. Okay, the next thing we're going to be checking is your neurological function, the cerebellar function. So go ahead and with your right heel, move it up the opposite leg, touching here, and go up with your heel. Good. Now the other one. All right, really good. Okay, that's really good. Now, go ahead and sit up for me. Okay, good. Make sure it's on. Okay, So as soon as when you got up, I noticed your position, everything was good, and your legs dangled, which they're supposed to. And now I'm going to be checking your sensations. I'm going to be touching spots on your body. Let me know if you feel sharp or dull sensation, okay? Dull, sharp, sharp, dull, sharp, sharp, dull, sharp. Okay, good. So the sensations are really good. And now, and also, let me just check your hands as well. Go ahead and relax. Okay. Just relax your hands. Okay. Dull. Sharp. Okay, good. Now, the next thing I'm going to be checking is I'm going to be checking your sensation with something very light. So go ahead and close your eyes. Whenever you feel something, just say now, okay? No. 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 Okay, good. So that was really good. Okay, the next test we're going to be doing is the position test. So I want you to close your eyes. Just one hand. Close your eyes. This is up and this is down. Okay, so close your eyes, and when I move your finger, tell me what position is it, up or down? Down. Up. Up. Okay, good. So the position test, you did really good. And now I'm going to be checking a strychnosis test. Go ahead and close your eyes. I'm going to place something in your hand, and you're going to tell me after you feel it what it is. Keys? Okay, good. So that's good. Okay, now I'm going to be checking the cerebellar function in the upper extremities. So just put your hands on your lap and keep rotating them. Good. A little bit fast. And faster. And faster. All right, really good. Okay, so that was the cerebellar function test, which was really good. Now, the next thing I'm going to be checking is your reflexes with the reflex hammer. First, we're going to check your bicep right here. Your bicep reflexes. Just relax. Okay, good. This way. Okay, here we go. You can just rest it there. Okay, that's good. Now I'm going to be checking your tricep reflex. Just relax your arm. Just relax, okay. Okay, good. And now next I'm going to be checking your the tricep or the brachial radius pulse, which is your reflex, I mean. Just relax your hand. Okay, good. And the last one is the quadricep reflex. Can you move up a little bit back so they can dangle? Okay, good. Relax. Okay, good. So the reflexes was really good. Okay, now and also your Achilles reflex, which is right here. Okay. Okay, good. And the next thing, and your plantar reflex. Okay, good. Your plantar reflex, your toes, they plantar reflexes, which is good. There was no Babinski sign or reflex. So the next thing I'm going to be checking is the lower extremities, which I already checked for to make sure your skin is good, your no lesions or anything. Now, if you can go ahead and stand up for me. Okay, good. And go stand there. Okay, good. Now I'm just checking, and you did really good when you walked, which was good. Now, when you walk back, I want you to do a heel to toe fashion. Okay, good. Okay, turn around. And now I want you to walk on your heels. Or your tippy toes, sorry. Walk that way on your tippy toes. Okay, really good. And now I want you to walk on your heels. Just a few steps on your heels. Okay, really good. Okay, now come stand here. Put your feet together. Okay, close your eyes. Just relax. Okay, I'm just assessing the Romberg sign, which is really good. All right, now go ahead and open your eyes. Okay, good. Now turn to the side. This side. Okay, just relax. Okay. And I want you to bend each knee. Just bend it. Okay, good. Now the other one. All right, really good. You did really good. Okay. Now the next thing we're going to be doing is I'm going to be checking your spine. So if you can just turn around and bend down and touch your toes. Okay, really good. And go ahead again. Touch your toes. Okay, good. And you want to make sure that the spine is straight and is symmetrical, which it is. Okay, good. Now I want you to go ahead and stand up. And I'm going to check, hold right here and go ahead and move back. Okay, and that's checking the range of motion of the spine. You can move back. Okay, good. Now go ahead and twist to the right. Okay, the left. And bend to the other side. Okay, now the other side. All right, really good. You did excellent. So go ahead and have a seat. And the last exam left is, it would be, if we were in the office, it would be examining your genitalia. And we usually put the patient in a lithotomy position with both of their legs on the side. And with the vaginal speculum, I would go in and check your cervix and the uvula, make sure everything is within normal range, no lesions, nothing abnormal, no discharge. Check your cervix and the mucosa, make sure everything is within normal range. And I would also do a bimanual examination with my fingers and feel inside the vaginal wall and make sure I don't feel any lumps or anything unusual. And at the same time, I would check the rectal and check for any occult blood if I get some sample on my finger. So that would be the examination of your genitalia. And so do you have any questions or concerns throughout the whole examination?
Thank you.
All right, you did really good. Thank you so much for your time and patience. All right, take care.